Shocking truth about diabetes revealed. Hello, and welcome to this 1-hour video on diabetes, its prevention, and correction. Diabetes is a chronic disease that affects millions of people worldwide, and it is essential to understand its causes, symptoms, and ways to prevent and correct it. In this video, we will cover everything you need to know about diabetes and provide you with links to free online resources that you can refer to for more information. Chapter 1: Understanding Diabetes. In this chapter, we will provide an in-depth overview of diabetes, including its definition, causes, and different types. We will explain that diabetes is a chronic condition that affects the way the body processes blood sugar, glucose, and discuss the differences between type 1, type 2, and gestational diabetes. We will go into more detail on the causes of diabetes, including genetics, lifestyle factors such as diet and exercise, and other medical conditions that may increase the risk of developing diabetes. We will also discuss the impact that diabetes can have on the body over time if left uncontrolled, including damage to the heart, kidneys, and eyes. Diabetes is a chronic disease that affects how your body processes blood sugar, glucose. Glucose is a vital source of energy for your body's cells, but when you have diabetes, your body either doesn't produce enough insulin, type 1 diabetes, or doesn't use insulin effectively, type 2 diabetes. Insulin is a hormone produced by your pancreas that helps your body convert glucose into energy. In type 1 diabetes, the immune system attacks and destroys the cells in the pancreas that produce insulin. This means that people with type 1 diabetes need to take insulin injections or use an insulin pump to manage their blood sugar levels. In type 2 diabetes, the body becomes resistant to insulin, or the pancreas doesn't produce enough insulin. This means that people with type 2 diabetes may need to take medication, make lifestyle changes, such as eating a healthy diet and exercising regularly, or both to manage their blood sugar levels. Gestational diabetes is a type of diabetes that develops during pregnancy. It can increase the risk of complications during pregnancy and childbirth, but in most cases, it goes away after delivery. Risk factors for diabetes include genetics, age, obesity, physical inactivity, and certain medical conditions, such as high blood pressure and high cholesterol. Some ethnic groups, such as African Americans, Hispanic/Latinos, and Native Americans, are at higher risk of developing diabetes. Chapter 2: Symptoms and Diagnosis. In this chapter, we will discuss the symptoms of diabetes, how it is diagnosed, and the importance of early detection. We will cover the classic symptoms of diabetes, such as frequent urination, increased thirst, and unexplained weight loss, and explain how these symptoms develop. We will also cover the different tests used to diagnose diabetes, including the A1C test, fasting plasma glucose test, and oral glucose tolerance test. We will explain how these tests work and what they measure. We will also discuss the importance of regular checkups and monitoring for people who are at risk of developing diabetes. The symptoms of diabetes can vary depending on the type of diabetes and the severity of the condition. Some common symptoms include frequent urination, increased thirst, increased hunger, fatigue, blurred vision, slow healing sores or cuts, numbness or tingling in the hands or feet, unexplained weight loss, type 1 diabetes. To diagnose diabetes, your doctor may use one or more tests, such as A1C test. This test measures your average blood sugar level over the past 2 to 3 months. Fasting plasma glucose test. This test measures your blood sugar level after you have fasted for at least 8 hours. Oral glucose tolerance test. This test measures your blood sugar level before and after you drink a sugary drink. If you have symptoms of diabetes or are at risk of developing diabetes, your doctor may recommend that you get tested for the condition. Chapter 3: Prevention of Diabetes. In this chapter, we will discuss the various ways to prevent diabetes, including lifestyle changes, such as diet and exercise, and medication when appropriate. We will provide evidence-based recommendations for maintaining a healthy diet, such as limiting sugary and processed foods and increasing fiber-rich foods. We will also discuss the importance of regular physical activity and stress reduction for diabetes prevention. We will provide practical tips for incorporating exercise into everyday life and discuss the benefits of stress-reducing activities, such as mindfulness and meditation. To help viewers understand the importance of prevention, we will provide real-world examples of how lifestyle changes can reduce the risk of developing diabetes. We will also provide links to free online resources that can provide more information on diabetes prevention. Preventing diabetes involves making healthy lifestyle choices that can reduce your risk of developing the condition. Some ways to prevent diabetes include eating a healthy diet. Focus on eating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed foods, sugary drinks, and foods high in saturated and trans fats. Exercising regularly. Aim for at least 150 minutes of moderate intensity exercise per week. This can include activities such as brisk walking, cycling, or swimming. Managing your weight. Maintaining a healthy weight can help reduce your risk of developing diabetes. Managing stress. Stress can affect your blood sugar levels and increase your risk of developing diabetes. Find healthy ways to manage stress, such as meditation, yoga, or talking to a therapist. There are also free online resources that can help you make healthier lifestyle choices, such as myplate.gov, choosemyplate.gov, and the American Diabetes Association's Diabetes Food Hub. Chapter 4: Management of Diabetes. In this chapter, we will discuss the different ways to manage diabetes, including medication, insulin therapy, and lifestyle changes. We will explain how medication and insulin work to control blood sugar levels, and we will provide information on the different types of medication and insulin available. We will also discuss the importance of lifestyle changes for diabetes management, such as maintaining a healthy diet and regular physical activity. We will provide tips for managing blood sugar levels, such as monitoring blood sugar regularly, adjusting medication or insulin doses as needed, and managing stress levels. To help viewers understand the importance of diabetes management, we will provide real-world examples of how managing blood sugar levels can prevent complications such as heart disease, kidney disease, and nerve damage. We will also provide links to free online resources that can provide more information on diabetes management. Managing diabetes involves making lifestyle changes, taking medication, and monitoring your blood sugar levels. Some ways to manage diabetes include medication. If you have type 2 diabetes, your doctor may prescribe medication to help lower your blood sugar levels. Chapter 5: Correction of Diabetes. In this chapter, we will discuss the various ways to correct diabetes, such as weight loss, bariatric surgery, and pancreas or islet cell transplantation. We will explain how these treatments work and provide information on who may be a good candidate for each type of treatment. Conclusion. In conclusion, diabetes is a chronic disease that requires careful management and attention. However, with the right information, support, and resources, you can prevent and correct diabetes and live a healthy and fulfilling life. We hope that this 1-hour video has provided you with valuable information and resources you find useful. Thanks for watching, and we wish you all the best in your journey towards a healthy and happy life. Do not forget to subscribe and turn on the notification bell for more contents like this.